to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and here are the recent developments in the medical world. How lifestyle changes can help manage type 2 diabetes. A lifestyle intervention program of increased physical activity, healthy eating, and aiming for weight loss of 7% or more, or taking the medication that is metformin, were effective long-term to either delay or prevent type 2 diabetes in adults with pre-diabetes. Neither approach, however, reduced the risk of cardiovascular diseases for study participants over the 21 years of the study that was conducted. The study here is published in the American Heart Association's Circulation Journal. The study included close to 3,200 adults who participated in the original 3-year diabetes prevention program trial, which was the DPP trial. The analysis of the study focused on determining whether the medication, that is metformin, or the lifestyle intervention might reduce the risk of cardiovascular disease or even the rate of major cardiac events such as heart attack, stroke, or death due to cardiovascular diseases. There was no significant differences in the incidence of such events among the intervention groups. Specifically, the analysis found that there was a continued reduction or a delay in the development of type 2 diabetes for up to 15 years. The number of non-fatal heart attacks across each groups was similar, that is accounting to 35 heart attacks occurred in the lifestyle intervention group, 46 in the metformin group, and 43 in the placebo group. Similarities were also found in the number of non-fatal strokes, that included 39 incidences of stroke in the lifestyle intervention group, 16 in the metformin-only group, and 28 in the placebo group. The number of deaths due to cardiovascular occurrences were low, that is 37 deaths among the lifestyle group, 39 in the metformin, and 27 in the participants who took the placebo during the original trial. The fact that neither a lifestyle intervention program nor metformin led to a decrease in the cardiovascular disease among people with pre-diabetes may mean that these interventions have limited or no effectiveness in preventing the cardiovascular diseases, even though they are highly effective in preventing or delaying the development of type 2 diabetes. What effect alcohol has on our heart? Levels of alcohol consumption currently considered safe by some countries are linked with the development of heart failure, as per a research that was presented at the Heart Failure 2022. This was a secondary analysis of the STOP-HF trial, which was the St. Vincent's Screening to Prevent Heart Failure trial. The STOP-HF provides an excellent model to the global community on how to integrate the primary care simple screening with secondary and tertiary level targeted diagnostic and therapeutic system. The study included 744 adults over 40 years of age, either at risk of developing a heart failure due to risk factors or with a pre-heart failure condition. The participants were categorized according to their weekly alcohol intake, either into none, a low, moderate, and a high group. A total of 27% of the patients reported no alcohol usage, while 48% were low users and 25% had moderate or high intake. In the pre-heart failure group compared with no alcohol use, moderate or high intake was associated with a 4.5-fold increased risk of worsening the heart health. The study suggests that drinking more than 70 grams of alcohol per week is associated with worsening the pre-heart failure condition, or rather progression to a symptomatic heart failure. Hence, their results indicate that countries should advocate lower limits of safe alcohol intake in pre-heart failure patients. The effects of premature birth on lung function in babies. A recent study reported in the Respiratory Medicine investigated the effects of prematurity on the lung function into middle age. The study found that very to moderate prematurity is associated with an obstructive lung function deficits, including either a chronic obstructive pulmonary disease well into the 6th decade of life, and that this effect is advanced by personal smoking. Data were analyzed from 1,400 participants where the lung function was measured at 53 years of age. Gestational ages were very preterm, moderate preterm, late preterm, and term. Of the 3,565 patients, 41% of the participants were included. Compared with term birth, very to moderate preterm birth was significantly associated with an increased risk of COPD. The association between very to moderate preterm birth and the forced vital capacity ratio was only significant among the smokers group. Well, compared with the term birth, the late preterm birth was not associated with lower forced vital capacity ratio or a COPD condition. Therefore, the researchers concluded that very to moderate prematurity is associated with an obstructive lung function deficits, including the condition of COPD, well into the 6th decade of life, that this effect is compounded by personal smoking. Herbal medications that are helpful in treating such pruritus cases. A new review cited in the Journal of Cosmetic Dermatology conveys that herbal remedies and complementary medicine may have a good therapeutic response in the treatment of chronic pruritus, and that the conventional medication may not always be helpful. So some investigators and patients did use herbal and complementary remedies for their treatment. However, limited data exists regarding the effectiveness of these treatments. For the present study, the researchers reviewed clinical trials where herbal and complementary medicine both were used for the treatment of chronic pruritus. Herbal remedies included the use of turmeric, fumaria, parviflora, avena sativa, capsaicin, sweet almond oil, peppermint oil, violet oil and vinegar, as well as manual therapies they used including aromatherapy, auricular acupressure, acupuncture were some of that was significantly effective in the treatment of chronic pruritus. Some studies showed a reduction in the pruritus cases in both the control and placebo groups, and that the effect of complementary and alternative remedies were more effective. Hence, the practitioners can consider the use of herbal medications for the treatment of chronic pruritus. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.